Hey, I'm back. It's that week, right? I thought I would walk you through my diagnosis. So originally I felt a lump in my right breast, on the bottom part in about May, in 2022. And every year in Japan you have a Kenkoushin done, which is a health check. And usually they're carried out by your company. And, they do the regular things: height, weight, eyes, hearing, x-ray. They do a urine test, a blood test. But you can get extras put on. So for women, you can get things like a pap smear or a mammogram, ultrasound, all those sorts of things. So this year, because I felt the lump, I thought I would get a mammogram and an ultrasound. And even though my doctor in Australia said I could do a pap smear every 5 years, and I'd just done one maybe a couple of years before, I thought I'd do that as well. And it cost me an extra 2.5 mon, so about $2,500, and this was out of pocket, even though the health check itself was covered by my company. I got the results back about a month later, and it said mammogram all clear, ultrasound all clear. And they have a doctor check through all the results with you just before you leave. So I thought, okay, well, that's good. But it kind of just didn't sit right with me. I could actually feel the lump growing, and it was getting more noticeable to the point where like bras would become uncomfortable. Then we went home for Christmas in December 2022. And one of my friends is a doctor, and I said, this is probably weird, but can you just check me out? So she did a breast exam, and she said, it's probably nothing, probably a fibroadenoma, but I'm going to get you a referral with one of my friends who's a plastic surgeon and specializes in breast reconstructions and implants and, all things to do with plastics. And she suggested, we'll just get a mammogram and an ultrasound just to be sure, but you're young, so it's probably just a fibroadenoma. I went to go get the ultrasound and mammogram a couple of days later at Radiology. And this I had to I went in because sometimes you can just go in, but for this I needed to book in for it, so I went in a couple of days later. And they originally just did the ultrasound and said, it's a lot of radiation, so maybe we won't do the mammogram because you're very young and you'd already had one like 6 months ago. But then she said, it will depend on what the doctor says. So they do the ultrasound, and the lady is just sort of focusing a lot on my right breast and then my underarm where my lymph nodes are. And then I could hear her go, just like a very strong inhale. And I go, oh, did you find something? She goes, oh, we're not sure. It's best to get it checked by the doctor. And then I think, well, obviously it's the worst. And then I wait, and after she goes and checks with the doctor, she says, we will do the mammogram just in case. And okay, sure, just in case, but I wasn't really feeling great about it at this point. And mammograms, I don't know if you've had them, but they're very uncomfortable. You're right up against the machine and they squish your boob like this way, and it has to be in so tight that the mammogram technician has to like basically hug you to get you in there. And then I got the results about a day later because my friend's friend was the doctor, and the radiologist there, he said it looks abnormal. Basically, I needed to do a biopsy. Like, biopsy was recommended. And then my friend's friend, she actually called me and said, so, hey, I got the results. And, if it was normal, I'm sure she would have just texted me. But she's like, look, we got the results, and we're not really sure what it is, so it's just best that you go and get it checked out and do a biopsy. But at this point, I was getting married the next day and then leaving for Japan the day after because I live in Japan. And she's like, look, I don't think anywhere would be able to get a stat biopsy in like this quickly, but it might be better to do it in Japan because that's where you'll receive treatment if you need it. Now it's probably fine, but you know, best to get it checked out. And like, obviously at this point I was pretty upset because I'm a worrier. I always think about the worst thing. But anyway, I decided to research some different English-speaking breast clinics in Tokyo, and I decided to go with Jiugaoka Breast Clinic because it's pretty close to where I live. So they booked me in for about 2 weeks after I returned. That was the soonest they could get me in because that's when the English-speaking doctor was available. And, you know, I sent them my referral letter from the Australian radiologist. I also took in my mammogram and ultrasound films and CD. And they looked at this, and then she did her own ultrasound and said, you know, we will do the biopsy today. Do you have time? And I was like, yes, because it was after work anyway. And the biopsy was not comfortable. So it was a core needle biopsy. And first they put in like a numbing injection, which actually really hurt a lot. But then afterwards she's like, can you feel anything? I was like, no, but I'm a worrier, obviously. And there was a really nice nurse there, and basically I was lying down and she was just sort of tapping my legs. And I don't know, it was really comforting. But the needle thing is giant, and that's why you need the anesthetic. But she goes to me, look, you won't feel anything, but you know, it's a pretty big sound that you're going to hear when the needle goes in. And I thought, oh, okay. She's like, so just be aware of that. And it's like bang, like straight into your breast. And I could sort of feel the movement, but it didn't hurt. And she did it about 5 or 6 times. So it was really uncomfortable. Basically, they have to make a tiny, like 2mm incision to get that needle in because it's so big. Anyway, after that, she just sort of applied pressure. She's like, yeah, just to stop the bleeding. And then she's like, oh, you're still bleeding. And I thought, well, that's not good. And she's like, okay, so after this, you know, you can't shower. And I was like, what? I can't shower? I've just finished work. And she's like, well, you know, you can shower the lower area, and wash your hair separately. And I was like, I'm just not going to wash my hair. But I felt disgusting. And she's like, you know, don't drink alcohol. Don't have a hot bath. Don't shower this area. Don't get the dressing wet. And there's a little tiny bandage on it that's meant to make it heal quicker. So just leave that on unless it gets too itchy. But from tomorrow you can resume your normal day. Later that night it did start to hurt, and then it just kind of hurt the next day. So even though they say, yeah, continue your day, I recommend just taking a day off the next day if you can. So I went back a week later for the results. Like, they don't call you, you have to go in. And then I remember I was sitting there, and then she's like, it's not good news, it's bad news. And then I just sort of started crying. And then it's so funny because every doctor's office I've been in since then, they just have a like surprise hidden box of tissues ready for when you just burst into tears. And she just like, you know, stealthily slipped the tissues in front of me. And she's like, you have invasive ductal carcinoma. And I was like, oh, cool, great. She's like, it's really aggressive and fast growing, especially because you're young. And I was like, oh, great. And she's like, look, in a week, we're going to have your hormone sensitivity results. And I was like, cool. And she's like, so you'll have to come back in for that. And that was it. And she's like, do you have any questions? And at that point, I was just like, no, like, what stage? She's like, oh, we don't know. And I was like, okay, great. So I was like, what do I do now? She's like, well, we've got to wait for the hormone sensitivity results, and then I'd like you to pick a hospital where you could do your treatment. And I speak some Japanese. I actually got my N2 Nihongo no ryoku shigen. So that's good. But obviously medical Japanese, I'm just like, psh. so she recommended St. Luke's, which is the best English-speaking hospital for this sort of thing, but it's private, obviously, and super expensive. She also recommended Showa University Hospital, which is very close to my house. Then where else? There's a National Cancer Institute in Shinjuku, but it's just so packed that it's like kind of hard to get in. Then there's also some other one. I can't quite remember. I'll find the information and I'll put it up. But, you know, my boss, actually, she's so amazing. When I told her, she just got straight away onto the research, and she's like, look, St. Luke's is really good, but, you know, it might take a while to get in there because it's so popular, but everyone speaks English and it's really great, but it's really expensive. I'm like, yeah, it's really expensive. She's like, no, not like America. We'll be fine. And I was like, all right. And then she's like, National Cancer Institute is good. They also speak English, or they can get interpreters, but, you know, it's very busy. And I was like, all right. And she's like, okay, Showa's really good, and it's close to your house. And I was like, cool. She's like, they may not speak English. And I was like, all right. But then my breastie, so she had a friend who got her treatment at St. Luke's, but then that doctor actually moved to Showa University Hospital, and then obviously we know he speaks English, so I was like, oh, well, that's also good. But my boss, she has a friend who went to Harvard, went to Tokyo University, and he's like a leading expert in like the cancer field. So she's like, I'm going to get his opinion to see where you should go. And he suggested St. Luke's, but, you know, obviously it's kind of far and expensive. So he works at Juntendo University now. My boss was like, what about there? He'll be able to get things done there because it's all about who you know in Japan. And I was like, well, I know nobody. Well, I know you. And she's like, I'll get things done. And she really did. So I decided to go with Showa University Hospital in the end because it's close to my house. And, obviously, Dr. Hayashi, who used to work at St. Luke's, now works at Showa University Hospital. I know he speaks English. It just seemed like the best choice because it's big enough, but not too big, that my care will sort of be neglected, I guess. I'm sure that doesn't happen, but I was just worried about it. So I called up, and then they're like, oh, so you need a referral. And I was like, oh, but I'm going to get one from my doctor soon. They're like, oh, okay. But so I told my boss this, and then she just called up and she was like, look, so, you know, one of my employees, she doesn't have a referral yet, but I was just wondering, you know, what could you do to squeeze her in? And she's just yammering away in, you know, super polite, but like firm Japanese. And they got me in. They got me an appointment, even though I didn't yet have the referral. And then she called up my original clinic, Jiugaoka Breast Clinic, and she said, you know, we're able to get her into Showa Dai, but she needs a referral ASAP, so I was wondering if you could do anything about that. And they were like, oh, okay, we'll speed up her appointment. And they got me in a week earlier. So I had the Showa Dai appointment on Wednesday, and then the Jiugaoka Breast Clinic appointment on Tuesday, where I would get the referral. But then, because she was so nice about everything, and I guess they sensed the urgency, Jiugaoka Breast Clinic called me up on Saturday and was like, hey, so we got your results in, just wondering if you could come in maybe today. And I was like, oh yeah, that's great, that works for me, it's a Saturday. So I go in, and my husband comes with me this time, and she's like, so we got your hormone sensitivity results. And I did a bit of research before this because I was like, what is the best thing for me to expect? And I'm triple positive, so estrogen positive, progesterone positive, and then HER2 positive, which is the most treatable cancer because they know how to treat it, I guess. But it's also like the one most likely to come back, which is like still the best news I could possibly receive. So after that, I go to Showa University Hospital, and originally my appointment was for Wednesday, but then they called me out Tuesday night, and they were like, oh, so can we change your appointment to Thursday because the doctor actually speaks English? So in Japan, the way they do it is you have to go see some other like doctor first, and then you can see the doctor who you've actually been referred to later. So the doctor I got studied in Ireland and had an Irish accent. Her name's Dr. Murakami. And she was like, okay, so, you're young. We're going to just do some tests. I've got all your information here. And then that day, I think I went in at 9 and I left at about 2 because I had bloods, had a urine test. And I was like, so can I do the BRCA test? And she's like, oh yeah, because of your age and everything. But, it's covered by insurance, but it's still about Hachiman. So like, 80,000 yen, which is like what, $900. And that's the insurance covered price. And I just like looked over at my husband and he was like, yeah, I'm BRCA negative, but I haven't done any other genetic testing. So I think I will do that. Stay tuned for that. I did an ultrasound again. I did an x-ray. I'm not sure what they did with all this info. But then a week later, I had to go back to get those results. BRCA doesn't come in for like 3 weeks or so actually, but she was like, look, it looks like it hasn't metastasized. That's good. But your lymph nodes are still a bit, and she's like, look, we're going to categorize this as stage 2B at the moment. We're going to recommend 6 months of chemo followed by surgery because that's just how they do it now. And then like, radiation or chemo after, and then like 15 years of hormone therapy. And I was like, cool. This is great. And for that appointment, my breastie came with me. And like, again, I was just kind of a mess. I was just like, what do I do? And she was asking all these questions, and turns out we're actually cancer twins. So we have the same type of cancer. It's invasive ductal carcinoma. We're both triple positive. It's crazy. Both BRCA negative. And then she's like, look, next week you're going to see Dr. Hayashi and he'll probably say the same thing as me. And I was like, okay. So my husband came with me for that. And then he's like, look, no metastasis. I was like, yeah, sweet. And then he goes, but this like lymph node looks kind of a bit inflamed. So we're going to check that out. And I'd had this weird, horrible cold that week before, which wasn't COVID, wasn't flu. I tested so many times, but I had fever. I had body aches. I was fatigued. I had a headache, like stuffy nose, cough, everything, the works. So maybe that's why it was inflamed. I don't know. Anyway, he introduced me to Dr. Matsui, who's this like same age as me doctor. And he's like, he's going to be doing your biopsy. And I was like, sweet. And he's like, we're also going to do a PET CT scan on you, but you have to go to, Yotsuya Medical Cube because we don't have that machine here. And I was like, okay. So I get the PET CT scan. It's like you get this dye injected into you and you can't eat. And then it's basically, like a, MRI type thing where it goes around you and you have to stay really still. Then that was on the Saturday. On the Wednesday afterwards, I had my, fine needle aspirate biopsy in my lymph node under my arm with Dr. Matsui, and like, they just showed me the needle. I was like, so that looks pretty big. And they're like, oh yes, it's big, but it's thin. And I was like, okay. And I was like, so can I get some anesthetic? And they were like, no, it's like a blood test needle. It's thin. I'm like, that still hurts. And he's like, you'll be okay. And then so he's like, all right, are you ready? And I was like, no. And he just like shoves it in. And I was like, oh, it didn't hurt, but it was just more uncomfortable. And he kept like jiggling my underarm area, I guess. And it was just in there for a good 5 minutes. Kind of, I could feel it moving around. So a week later, I go back to Showadai and I see Dr. Hayashi, and he's like, so no metastasis, your lymph nodes are good. And I was like, sweet. And then he goes, so we're going to categorize it as 2A, but daijobu, you'll be fine. You're young. So he's like, you'll be fine. You'll be okay. You're young. Do you want to have kids? And I was like, no. And he's like, even after, because like, the chemo is going to make your body age 10 years. And I was like, cool. Yeah, no, kids are not for me, which like, I guess is good in that sense because I wouldn't have to delay my treatment. But it's one of those things. Like, I don't want to have kids, but it would be nice if it was my choice. And, I'm still trying to wrap my head around everything because I still don't know why. But that was the story of my diagnosis. So all I have to say is just trust your gut. And if you notice anything, go and get it checked out. And if they turn you away, or if they ignore you, or if they say it's fine and you don't feel like it's fine, go and get a second opinion. Because I could have easily been like, yeah, they said it was fine, it's fine, and didn't check it. But I was like, this doesn't feel fine. So I went to get it checked out again, and turns out it was cancer. So I could have had my treatment start 7 months earlier, or 9 months earlier, actually. So I'm still really like salty about that. Anyway, subscribe and stay tuned for more updates.